Welcome back. Getting a diagnosis of breast cancer is life-changing in itself, but then a woman begins a journey of making a whole list of other decisions about not only her treatment, but also about what comes next. One of those decisions has to do with breast reconstruction. And joining us now, Dr. Frank Barone. Before we get to the options, we do also, Doctor, want to talk about the emotional impact of deciding something like this. So here, let me scoot a little bit here. Give us an idea. For most people who are going through treatment, you don't know this kind of thing until you're in that position or someone you love. So first, tell us about the emotional impact of going through this process.
Well, yes, after the physical impact of breast cancer, there's also a psychological and emotional impact. This affects not only the patient, but their spouses, their families, a woman's self-confidence, because the breast is associated with femininity. And for many women, it has a profound impact, not just when the cancer is removed, but for the rest of their lives and after. And that's why the reconstruction can play such a major role in quality of life for these patients.
How many different options would a patient actually have in this case in terms of things to consider?
Well, the good news is now there are more options than ever, better options, more choices, but the patients need help navigating that and deciding what's the best individualized treatment based on the type of cancer, their age, and other factors. So we look at it as a partnership and a long-term patients for life relationship with their reconstruction choices and helping them navigate those choices.
Is there a time window within which they need to make this kind of decision?
Well, with many younger women being diagnosed with breast cancer, particularly under the age of 40 and 45, young mothers, now the most common option is to do the reconstruction or start it right at the time of the cancer removal, which shows improvement in a patient's outcome. So they don't have to go for a separate surgery for that. And there's more choices on the type of reconstruction using the patient's own tissue, such as from the abdomen for the reconstruction, improvements in implants, improvements in safety, and more natural appearing reconstructions.
And you have a special event coming up tonight, a free event at that. Give us an idea of what it's about.
We do. We're very excited about it. Today is Breast Reconstruction Awareness Day, which is basically started to inform patients of their choices. It's about education, about knowing your options, because the most informed patients make the best choices. So we're having an event tonight at Rosie's Italian Grill, a place near and dear to my heart, at 6 o'clock to 7:30, and we're inviting any breast cancer patients or anybody interested, and bring a friend to come and celebrate with our patients and our nurses and everybody else.
And maybe get some questions answered. They maybe want to look into some of this stuff.
Yes.
And we understand that RSVP, you do need to RSVP for this, and we have that number on your screen right now, 419-720-2008. Space is limited, so if you're interested in checking out this event tonight, give that number a call. Thank you so much for being here with us, Doctor.
Thank you so much, Sasha.
Tony?